So, from the beginning of the pandemic, when we first realized in March 2020 that this would profoundly affect us here in Canada, those of us working in prison health advocacy sounded the alarm from the get-go that COVID would have a disproportionate impact in prison contexts, those congregate living contexts. And we were, of course, not wrong about that. In addition to the risk to health that COVID has posed, we've had outbreaks across the country in many of the prisons, including several of the prisons designated for women. We see that people's lives are even more circumscribed. The loss of liberty that incarceration entails has, in the COVID era, been coupled with extreme human rights abuses, denial of access to family. In my research, I have interviewed women who went months without even being able to phone their children because they certainly had no in-person visits. And so, on the one hand, this is extraordinarily hard for women and causes extreme emotional distress. But we sometimes fail to account for how damaging this is to children and our obligations under the UN Convention on the Rights of the Child to design our policies and our public services in the best interests of children. We're certainly not doing that. My research really looks at, on the one hand, how damaging incarceration is to health, in particular sexual and reproductive health, how incompatible it is to achieve health and deliver health services in this context. But it also looks at how solutions need to be grounded in community-based solutions, in decarcerating. So rather than bringing healthcare into prisons, bringing people who experience criminalization out of these violent contexts and supporting their health, their families in